And now it's time to present the National Magnet Nurse of the Year Awards. These 5 accomplished nurses will each be introduced by members of the ANCC Magnet Commission. And here to start things off is Dr. Jeanette Ives Erickson.
Thanks so much, Pat, and hello, everyone. The National Magnet Nurse of the Year Awards recognize the outstanding contributions of clinical nurses from Magnet-designated organizations. The awards are presented for each of the 5 Magnet model components. I'm excited to be presenting our first 2018 Magnet Nurse of the Year for new knowledge, innovations, and improvements. She is a multitasking pediatric nurse scientist, a passionate teacher, a mentor, an organizer, an agitator. Well, you get the idea. She won't take no for an answer. From Boston Children's Hospital, the award goes to Sandy Quigley. Sandy is a universally respected nurse who has fundamentally advanced the science and professional practice associated with pediatric wound, ostomy, and continence care, not only at Boston Children's, but throughout the world. Pediatric patients of all ages have long been at great risk for hospital-acquired pressure injuries. But this was not well recognized until Sandy took it upon herself to investigate. In the early 1990s, Sandy collaborated with nurse scientist Dr. Martha Curley to develop the Braden-Q scale for predicting pediatric pressure ulcer risk by adapting the adult-based Braden scale. This was the first major national nursing study to include pediatric patient populations. Since the adoption of the Braden-Q risk assessment scale, much has changed in the care of pediatric patients, including advancement in technology and monitoring equipment. Therefore, in 2012, Sandy and Martha collaborated with a group of pediatric colleagues to organize a multi-center study to establish the reliability and validity of a pediatric pressure injury risk assessment scale, which would include medical device risk. Armed with these new findings, Sandy led organizational initiatives to implement and develop evidence-based improvements to prevent, and in many cases, eliminate hospital-acquired pressure injuries associated with commonly used medical devices. For more than 3 decades, Sandy has worked in both inpatient and ambulatory care settings, supporting and teaching patients, families, nurses, physicians, and the clinical team members about assessment and management of a variety of pediatric wound, ostomy, and continence care issues. Sandy is leading the conversation at the national and global level. Please welcome first Boston Red Sox fan, Magnet Nurse of the Year for New Knowledge, Innovations, and Improvements, Sandy Quigley.
Wow, amazing. Thank you so much, Jeanette. I'm honored to be the recipient of such a prestigious award. Over the past 34 years, wow, it's flown, as a nurse and a pediatric nurse practitioner, I am so fortunate to have worked at a magnet organization that values the impact that nursing research has on patients, making the Braden QD risk assessment scale a reality. Nurses lead almost all pressure injury initiatives around the country. I recall the many years I spent dispelling the myth that kids don't get pressure injuries. At Boston Children's Hospital, our motto is "Skin is in." And in the early 1990s, there was scant mention mention of pressure injuries in pediatrics. But clinically, I knew differently and began my collaboration with Dr. Martha Curley to discuss a conceptual model and develop a scale to identify patient risk factors. Over the past 2 decades, it's increasingly apparent the impact that medical devices have on pressure injury development. The occurrence reported surpasses immobility-related pressure injuries. The original Braden-Q scale did not identify any risk associated with medical devices. At this time, Kathy Noonan-Kayouette, my colleague in the audience today, joined us, and the plan for a study was born. The increased prevalence inspired a multi-center study to explore devices that caused injury and interventions which could improve outcomes. We had hoped that someone would replicate our original study to include medical devices, but nobody else did. So we rolled up our sleeves and we got started. The Braden-QD scale, D is for device, was developed from data derived from a broad, diverse sample of hospitalized pediatric patients preterm to 21 years old, including cardiac patients, and predicts both immobility-related and medical device-related pressure injuries. The findings in the scale are being published widely. There is also a teaching video in production. But if I am considered successful by my peers, it is only because there are so many great nurses that worked as a team. This has taken a village involving multiple hospitals, many of whom are also magnet designated. And our Boston Children's Hospital lead investigator, Linda Kulik, is also, I'm thankful she's in the audience today as well. This clinical research study was complex and challenging to pull off, and never could have come to fruition without the unwavering support of the nursing colleagues listed on the slide, who led their hospital's Braden-QD research study as site investigators. And last, I'd like to thank the nursing leadership staff at Boston Children's, Laura Wood, Marcy Brostoff, Patty Hickey, Yolanda Milliman-Richard, and my director, Herminia Shermont, as well as my children, Jared, Zachary, and Michaela. My daughter, Michaela, is here too. And my husband, Tim Quigley, himself a chief nursing officer of South Shore Hospital in Weymouth, Mass., a magnet hospital, but he's now forever really going to be known as Sandy Quigley's husband.
Wasn't that fantastic? Good afternoon, I'm Brian Seelig, the Magnet Commissioner. Congratulations again, Sandy. Our next Magnet Nurse of the Year must have been destined to make oncology care her specialty. From the University of Kansas Hospital in Kansas City, our Structural Empowerment Award winner is Lindsey Norris. Lindsey's dedication to the nursing profession, combined with her personal experiences, make her an inspiration to nurses around the world. 2 years ago, at the age of 33, with 2 very young children, Lindsey herself was diagnosed with stage 3C colorectal cancer. Supremely equipped to help other cancer patients, but totally unprepared for her own experience, she decided to document her personal journey. She started a blog as a personal therapy and to keep family and friends updated. But little did she realize the impact it would have. One of her first posts changed her life and those of countless others. She titled it, "Dear every cancer patient I ever took care of, I'm sorry I didn't get it." The blog quickly went viral, touching the lives of millions in 176 countries. Her unique perspective as both nursing professional and patient has inspired members of our profession worldwide to be better caregivers and patients to take a more proactive, positive role in their own recovery. Today, Lindsey serves as an advocate for oncology nurses and cancer patients here and around the world. With her positive outlook and upbeat approach, she's a shining representative of the heart and the spirit of oncology nursing. From the University of Kansas Hospital, please welcome my friend, Lindsey Norris.
Thank you, Dr. Selig. Working intimately with those who have cancer, I quickly found out how just sneaky and unforgiving this disease can be. I thought I really understood what it felt like to be a cancer patient, and I learned I had no idea. The news came after I was following up on some postpartum symptoms. All of a sudden, I found myself in the procedure room of the cancer center where I work, waiting for some emergent exams. The surgeon was sure of it, and after seeing his face, so was I. Cancer. From that moment forward, life turned into treatments, scans, surgeries, and doctor's appointments, all while working full-time. I couldn't get my patients off of my mind. So I started a blog and wrote them a letter. I apologized for not getting it, for not understanding how hard waiting for results can be, for not understanding how they hung on to every word I said and craved information, for not realizing how awkward it is to get all of the sad looks or to be called brave. I apologized for not understanding how exhausted and helpless they felt or how mood swings can sneak up with no warning. I confessed I didn't really get how much cancer takes over your life, barely leaving time or energy for anything else. I wrote that I didn't understand how strange it is to see your body changing quickly before your very eyes, so much that it's hard to remember what you really look like. I didn't get how much they worried about their kids, about how this would affect them, about how you could be able to still care for them, about leaving them. I was honored to have my letter reach so many readers and lead to so many patient advocacy opportunities. Hearing directly from other cancer patients that my words validated the feelings they weren't able to express has touched me deeply. But I've also loved hearing from other nurses. I've spoken with new hire groups at my organization, provided continuing education programs for nurses in my area, and had the opportunity to speak on panels at the national level, all in an attempt to deepen the connection between oncology, nurse, and patient. I'd be lying if I said the way I interact with my patients hasn't changed. I'm more tolerant now, and I read between the lines a little easier. Perhaps most important, I'm not afraid to ask the simple but tough questions like, how are you doing with all of this? I would love to thank my family and close friends for all the love and support that they've given me. Also, I'm grateful to Bob Page, Tammy Peterman, Jennifer McNeil, and all my nursing leadership and colleagues. Even if you have never experienced what your patient is going through, there are ways to find a deeper connection and listen a little closer. As for myself, I've only been cancer-free for a little over 18 months, and I still have so much to learn. Thank you. Thank you. Especially about how to move on and live life as a cancer survivor. One thing I know for certain, you don't have to get it to get it. Thank you.
Hello, I'm Commissioner David Marshall. Congratulations again, Lindsey. Wow. Our next Magnet Nurse of the Year award is for Transformational Leadership. From Scripps Memorial Hospital in La Jolla, California, the award goes to Elizabeth Batcher. Beth is a personality with super high energy. She engenders confidence and comfort in patients, physicians, and fellow nurses alike. She's always enthusiastic, warm, and sincere. But there's more to the Beth than a positive attitude. She lives up to the highest quality standards. She's a catalyst for transformation throughout her entire organization. That's why Scripps made her their own Nurse of the Year. When Scripps' historically high emergency department satisfaction began to slip, Beth led an effort to reverse the trend. She produced a video which helped bring attention to the problem and bump the scores back up. As chair of the Clinical Mentor Committee, she motivated and energized the group to collaborate on improving patient outcomes throughout the hospital. In general, Beth identifies changes that are needed, creates a vision, and inspires others to join forces to execute their ideas and create a positive experience for patients and staff. An excellent teacher, she works with new and transitional program staff to guide their learning in an effective, energizing manner, whether one-on-one or in the classroom. Her professionalism and generous nature serve as a model for all. From Scripps Memorial Hospital, La Jolla, please welcome Elizabeth Batcher.
Thank you, David. Oh my gosh, you guys, this is so exciting. Woo! It is incredible to be recognized by such a prestigious organization for simply doing what I love. To merge my two professional loves of nursing and teaching as a clinical mentor brings me such joy and satisfaction each day. I have had the privilege of being part of a few programs that transformed not only the way we deliver care in our emergency department, but spread throughout our community, hospital, and healthcare system. One of these programs is our Code Sepsis initiative. Along with an interdisciplinary team, I helped improve the recognition and early treatment of patients with sepsis in the emergency department. We created and adhered to consistent processes for treating patients with sepsis. Working together, our emergency department team has improved outcomes in sepsis patients by approximately 20%, which means 20% more lives saved and 20% more lives improved. In less than a year, mind you. I am also privileged to be the emergency department lead nurse and educator for the Emergent Extracorporeal Membrane Oxygenation, or ECMO program. Working closely with the hospital ECMO coordinator and our emergency physician lead, we developed an education program and redesigned our choreography of resuscitation. Combining evidence-based practice with advancements in technology, we developed specific roles, guidelines, standard work, and consistent practices for resuscitation. No matter what I am involved in, it is imperative to me to keep the patient at the front of why we do what we do. I truly feel that it is a privilege to care for people, especially in their most vulnerable times. Anyone who knows me knows that one of my mottos is that we should do the right thing because it is the right thing to do, period. I teach this to my young children, and I share this with everyone I work with and train in the emergency department. I encourage you all to be the spark of innovation, vision, and positivity, for those qualities are infectious and will create a fire of change and goodness. I would like to thank my strong and selfless mother for her endless examples of love, hard work, and everything that is good. To my brothers, my family, and my incredible friends, thank you for always standing by me through it all. To the entire team at Scripps Memorial Emergency Department, I truly couldn't have accomplished this without you. Special thanks to my manager, Rose Colangelo, Senior Director Kim Roberts, Chief Nursing Officer Cindy Steckel, and emergency physician Dr. Sean Evans for all your support and belief in me. I dedicate this award to my two daughters, Mia and Zoe. Girls, you motivate me and inspire me every single day to be a better person. Remember that even in the face of adversity or difficult times, great things are possible with hard work, staying true to yourselves, and moving forward with grace and gratitude. Thank you beyond words and beyond measure.
Hello, I'm Commissioner Bill Padula. Congratulations again, Beth. We've all been crying in the backstage. Our next Magnet Nurse of the Year award for empirical outcomes goes to a young man who has been a nurse for all of 3 long years. A clinical nurse at West Kendall Baptist Hospital in South Florida, Jobic Ray Butau. All right, now go. It's always a pleasure to witness the professional unfolding of a novice nurse. It's outstanding that in such a short time, this nurse could have advanced so far, impacting his patients and the practice in so many ways. Jobic joined the intensive care unit in 2015 as a resident in the health system staff development program. Since then, and listen to this, he has been voted ICU Employee of the Month multiple times, Hospital Employee of the Month, Nurse of the Year, received several DAISY nominations, and is Florida Nurses Association's RN of the Year awardee. Jobic is a member of numerous councils, a Magnet ambassador, and chair of Unit-Based Practice Council. Jobic is a dynamic peer leader. He is BSN prepared, CCRN certified. I'm running out of breath. He has a huge impact on the increase of certified nurses in the ICU. He consistently encourages his peers to take the exam, supports them during the review process. Jobic is a patient's advocate, committed and dedicated to the quality of care. And frankly, I don't see how he has enough time for all he does. Jobic's leaders are proud of him, his peers respect and admire him, his patients and their families love him. For all those who you worry about making an impact early in your careers, this is proof that it can be done. We cannot wait to see what Jobic does next. Please welcome the Magnet Nurse of the Year for empirical outcomes, Jobic Ray Butau.
Thank you, Dr. Padula. I'm so grateful to be receiving this award. In all honesty, nursing was not the first thing I decided to study. Growing up, my exposure to nursing was through my mother. She was a Magnet pioneer who then turned Magnet project director, and she lived and breathed Magnet. So in turn, I am a Magnet baby. And if you work with a Filipino nurse, you know that all Filipino mothers want their children to become nurses. Unfortunately for her, I secretly started off as a music major, but decided to switch after going with my church on a medical mission trip to the Philippines. I was able to experience a personal connection to how much compassionate nursing means to the underserved communities. I felt immediately that I wanted to be a part of that impact. Now, working for a Magnet organization, I immediately noticed how my unit encouraged me to own my practice. My first year, I discovered my passion for shared governance and became one of the officers in my unit-based practice council, working with my chair to develop a zero-county initiative. I was able to develop a performance improvement project called Hack Hours, which ensured bundled compliance in relation to the hacks that patients could develop. And during this term, my director asked me to assist him to improve the perception of RN to RN teamwork on the unit. So I developed a project called Fine Apples, a public recognition tool that promotes cohesive teamwork. Our most recent survey scores have jumped significantly above the NDNQI mean. At the end of my second year, I was chosen by hospital leadership to attend the 2017 Magnet Conference. At the time, our unit had been dealing with issues with CLABSI. And after sitting with my CNO in a concurrent session called Chasing Zero, I told her I was going to bring the initiative back to our hospital. That Magnet presentation inspired me to create Play-Doh Rounds, Proactive Leadership Attention to Outcomes. And these rounds are held twice a week alongside senior leadership, senior executive leaders, and interprofessional team members to assess the care of patients with invasive lines. Since my unit started the initiative 1 year in October, 1 year ago, the ICU has had 0 CAUTI and CLABSI. 0. Thank you. And now Plato has been in all the inpatient units for 5 months, and not one of them has experienced CAUTI or CLEPSY either. I've only been a nurse for 3 years, but I feel like I've had a lifetime of experiences. I could not have accomplished any of this without the support of my director, Bernie Arsena, and my educator, Joanna Barelia, and the entire West Kendall Baptist ICU team. I've always felt direct care from my CNO, Sandra McLean, and my MPD, Simone Chung. Lastly, to my family, but more importantly, Rosalina, my personal cheerleader, who is still a magnet nurse, I want to say, thanks, Mom. For always supporting everything I do. Glory to God. Thank you so much.
Hello, everyone. I'm Commissioner Melissa Klein. Congratulations again, Jobic, and our other Magnet Nurses of the Year. Our next Magnet Nurse of the Year is being recognized for exemplary professional practice. She is a palliative care advanced practice nurse at Parker Adventist Hospital, right here in Colorado, Dr. Yuki Asakura. Palliative care is a relatively new discipline with the goal of delivering patient-centered care based on a shared decision model. However, it is often confused with hospice care and end-of-life care, and a lack of referrals or late referrals is still a problem. Since palliative care was new to Parker when Dr. Asakura arrived 5 years ago, the consultation volume was very low. Dr. Asakura made it her personal goal to improve knowledge and awareness of palliative care and to make it more available to patients. Thanks to Yuki and her team, palliative care referral volume has increased by 400%. She also has a rich scientific background as a PhD-prepared nurse and is a sought-after mentor on quality improvement projects. She participates in numerous committees and serves as a chairperson for the Evidence-Based Practice Council. She has led a multidisciplinary study to assess EBP self-efficacy to identify clinical nurses' need for EBP support, which led to the development of a formal structure to improve clinical nurses' access to QI projects. She has been invited to speak at many universities and conferences in Japan, where until recently there have been no hospice programs or end-of-life care specialists. Her practice model is strongly scientific and nursing theory driven. You're about to find out why and how. Please welcome the Magnet Nurse of the Year for exemplary professional practice, Dr. Yuki Asakura.
Thank you so much, Dr. Klein. It's such an honor to receive this prestigious award and to be here with all of you, the best nurses in the world. When I became an oncology nurse in Japan more than 25 years ago, palliative care was little more than passive sedation or holding a patient's hand. That was the old days. I first came to the United States in 1999 with a group of BSN students from Japan. At the University of Colorado College of Nursing, I was exposed to the work of Dr. Jean Watson and her caring theory. Dr. Watson emphasized a patient value and a relationship-based care. This really inspired me. I was originally trained to be a clinician, but thanks to Dr. Watson's theory, I became guided by philosophy and the value system. Without the philosophy, we as nurses lose direction of how to use science and technology. When I started at Parker, there was a lot of misunderstanding of palliative care. Everyone thought I was a hospice person. Now palliative care has changed so much in the United States. evolving into an evidence-based, comprehensive model which addresses science, ethical concerns, and the philosophy. But in Japan, that need for a formal home hospice program is significant because most people still die in the hospital. Throughout my career, I have made a personal effort to provide education on palliative care across the disciplines. I have lectured, presented evidence, participated in skills fairs, and organized educational events. These days, palliative care is delivered by a multidisciplinary team that helps empower patients to define what quality of life means to them. In the old days, medical staff told the patient family what to do. Now, it's this shared decision-making. I have immensely benefited from the opportunity to teach End-of-Life Nursing Education Consortium, or ELNEC, courses, and to speak at national conferences, both in the United States and in Japan. And I have derived the greatest joy from giving a lecture together with my own original inspiration, Dr. Jean Watson. Please allow me to thank everyone at Parkland Adventist Hospital for their unwavering support. Thanks to Lucine Sarkisian, Dana Hammond, and all my palliative care colleagues. Thanks to Magnet Director Sarah Sweeter and CNO Mary Beth Trujillo for nominating me. And a special thanks to my husband John for playing personal assistant, editor, and sometimes cheerleader. I'm so proud to be a Magnet nurse. Together, we are proving that nurses can make an impact to change patient care. As we say in my native language of Japanese, arigatou gozaimasu. Thank you so much for this award.
Congratulations. I don't have to say, let's hear it again for our winners. Thank you. Isn't this an amazing representation of the nursing profession? I'm so proud to be a colleague. So thank you, thank you, thank you. And joining us on stage is representatives from EBSCO Health, Michelle Toseth, Clinical Effectiveness Officer, and Diane Hansen, CNO. Thank you so much for supporting the Magnet Nurse of the Year Award for Exemplary Professional Practice.